I was fed this advertisement by Blue Chew because I'm a young man on the internet. The only arousal-boosting 4-in-1, sildenafil, tadalafil, apomorphine, and oxytocin. Let's talk about this. I've already made videos about sildenafil, tadalafil, and oxytocin, so let's talk about apomorphine. So despite the name, apomorphine is a non-selective dopamine partial agonist, with most of the activity of the medication being attributed to the dopamine 2 receptor pathways. Dopamine agonist, huh? Like ropinirole, a dopamine agonist that's used in the treatment of restless leg syndrome and Parkinson's disease? Yeah, so this is Kynmobi. It's apomorphine in a sublingual film, and it's FDA approved in the treatment of Parkinson's disease. It was taken off the market because not a lot of people used it. And with the treatment of Parkinson's disease, apomorphine also binds to dopamine receptors in an area of the brain called the paraventricular nucleus, and one of the responsibilities of this area of the brain is regulating the autonomic nervous system, so the sympathetic nervous system, fight or flight, and the parasympathetic nervous system, rest and digest. Now, with dopamine agonism, you might be inclined to think that dopamine is a stimulant, so this means you're enhancing sympathetic drive, but we're actually getting enhanced parasympathetic activity around the body. So in medicine, we have a concept called point and shoot. You can use your imagination there, but apomorphine is helping with the point. It's helping initiate the erection. But be forewarned, this is Uprima, it's apomorphine in a sublingual tablet, and it was taken off of European markets, and it was never FDA approved in the United States due to side effects. So the main side effects with the apomorphine sublingual tablet were that people were fainting due to severely low blood pressure and dizziness, and this can all be attributed to the parasympathetic action. So, in my opinion, I'll give Blue Chew a little bit of credit in getting creative and using this sublingual tablet technology to use apomorphine and oxytocin in the treatment of erectile dysfunction. And if you really don't have any other health problems and erectile dysfunction is important to you, then this product may help you. But for goodness sakes, if this is not the case and you have any little sliver of concern, talk with your primary care provider or talk with your pharmacist. This is what we're here for. For goodness sakes, I really can't blame this company for having such aggressive marketing tactics, and I really can't blame patients for wanting to use a company like this because they make these options so accessible. I'm just trying to keep you all safe. That's my opinion.